Welcome, everyone, to our June General Membership Meeting. My name is Kevin Lee. I am the Programs and Member Services Coordinator here at the Coalition, and we have with us today Allison Eisinger, our Executive Director, Hallie Willis, our Policy Manager, Danielle Palmer-Freeman, our Communications Lead, and also welcoming our new Operations and Programs Manager, Christina Cabeza. Thank you all so much for being here. We've still got people making their way into the room. So we have a very full meeting. Thank you again for understanding as we dive just right into the intro and get started a tiny bit early. Like I mentioned, this meeting is being recorded. It will live on our YouTube channel, so if I can have somebody drop our YouTube channel link into the chat. We record all of our meetings and all of our trainings, so there's a ton of information there for service providers and the community. And we encourage you to subscribe to that channel. If you would like to not be in the recording, please utilize the chat and ask questions there to engage. We love to see faces, so if you're in a place where you're able to put your cameras on and that feels appropriate today, we love to see faces. You have the ability to change your name in the little Zoom box. We'd love to know who you are, what your pronouns are, and how you might be connected to the Coalition and this work. The Coalition on Homelessness is a member-based organization, and this meeting's intent is to bring people together, service providers, community, government partners, and allies alike. We come together every month on the third Thursday in the spirit of building community, exchanging important and timely information, offering professional development skills and resources, and working to create a sense of solidarity amongst ourselves. So we're truly glad that you're here with us today. We'll go ahead and get started with our slideshow. We do have, of course, a brief agenda, and I would love to get going our What We Do slide. This slide goes a little bit into more, we'll come back to the agenda, but the What We Do slide goes a little bit more into detail about what we do, who we are, and I encourage you to take a look. If you're with the media today, we really just ask that you quote and pull information from either Coalition staff or our official presenters. And if there's someone else that you're hoping to connect with, please reach out to contact@homelessinfo.org and we'll connect you with that agency for follow-up. Okay, so like I mentioned, we've got a great agenda today. If we could go back to the agenda slide, thank you. We're very excited. We have some amazing guests to help inform and get your people connected to needed resources. First, we'll hear about options for crisis care in King County. Ida Belfast and the Crisis Care Implementation Initiative Community Liaison from DCHS is here to share info and answer questions. We will then hear briefly from DESC regarding their MRCT services. And then after that, we will hear and learn about Sunbucks or Summer EBT. We'll be welcoming Natalie Martinez, the Sunbucks Program Manager from DSHS, to inform us and answer some questions that you may have. And then, of course, as always, we schedule time at the end of our meetings for community announcements. So please stick around. If you, we have some attendees ready to share some announcements at the end of the meeting today. If you have info to share, please email me at kevin@homelessinfo.org. Time permitting, we can possibly get you in today and certainly for the future. Okay, so now let's wrap up the meeting intro. I'm gonna switch gears back and I would love to ask somebody to volunteer to read out our mission, vision, and values. If you want to do this, just go ahead and raise your hand. Or if you'd like to volunteer.
I'll go ahead and do it, I guess.
Thank you.
Mission, we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision, a region that acts on a shared sense of responsibility to ensure that everyone has a home. Values are equity, justice, and collective action.
Thank you so much. Thank you, Melinda. This is a longstanding tradition of the coalition to read out our mission, vision, and values, because as you all know, this is the work that we all do and put into action. So with that, I would like to welcome Hallie Willis, our policy manager, to take it away and introduce our first guest.
Thanks, Kevin. Good morning, everyone. It's good to see your shining faces. If it's comfortable for you today to turn on your camera, that's always nice to see you. You won't be part of the recording unless you unmute yourself and speak. So just FYI. And I'm very happy today to introduce our first guest, Idabel Fossey from King County DCHS. Idabel works as part of the crisis care work that King County is doing, funded by the crisis care levy that was passed by the voters a couple years back. And Idabel is going to share with us today some really important updates on how all of that crisis care work is unfolding in King County, as well as all the resources that people can access if you are with a client or someone in your community who's in need of some crisis care support. So with that, I'm going to pass it to Idabel, and I might ask Kevin to help share slides today, if that's all right. Idabel, go ahead when you're ready. I think you're muted right now. Yeah. Put $1 in the jar. Yeah.
Amazing how often that still happens. Good morning, everyone. My name is Idabel Fossey. I use she, her, and ella pronouns. I am the Crisis Care Center Community Engagement Liaison. So many words. And I have been with the Crisis Care Center Levy since 2023. I have been working in working with people experiencing homelessness for many, many, many thousands of years. And so I'm excited to be here today. And I put in the chat a slide, an invitation to our upcoming open house for the new Crisis Care Center that will be opening up on Capitol Hill. That open house is going to be on July 21st at 5:30. It will be at the site in Capitol Hill. And if you could please RSVP, there is an email address on that slide for you to use. I will put that in the chat. And are we ready with my slides, or do you need me to go ahead and share mine?
Kevin, you got it? Okay.
My apologies, just some slight technical difficulties. I am getting this, trying to share screen here. My apologies, just a moment.
After the great dance party, I'll forgive you for anything.
Idabel, can you just remind us, since we have a couple of minutes here, when and where that open house is so we can show up in support?
Sure. The address is 1145 Broadway, and that's in Seattle. It's 98122. The event is Tuesday, July 21st from 5:30 to 6:30. It is an open house. You'll hear from Dr. Susan McLaughlin, who is the DCHS director, and Joel Conger, who is the president of Connections Health Solutions in the West region. And there will be resources from our community partners for that event. So the folks from DESC, as well as sound and probably the YMCA, and a few others.
Thank you.
And we would love to see you all.
And just as a little reminder to everybody, there was some pushback from certain individuals and some organizations about that location, which is the former polyclinic. What a perfect spot. And so many individuals and organizations, including the Coalition on Homelessness and probably folks in this meeting, showed up at county council meetings and said, this is exactly what our community needs. This is a good use of this former health facility. And so it would be great if you're able to show up in solidarity and support, because those conversations are, of course, ongoing. And we can say that, and Ida Bell can't, but we would really be well served by having supportive folks at that open house.
Thank you, Allison. All right, first slide, please. Okay, so for those of you who didn't remember the details, very briefly, in 2023, the voters of King County approved the Crisis Care Center levy overwhelmingly. And the mission of it was to make sure that we had someone to contact during a mental health or substance use crisis, someone to respond during a crisis, somewhere safe to go for folks who are having a crisis, and someone to follow up. Next slide, please. What we have now that we did not have in 2023 are a lot more free crisis services for everyone in King County. If you call or text 988, you can get immediate support for yourself or for someone else who's having a mental health or substance use crisis. If the person who is answering the call and you decide that a mobile crisis team should come out to take a look at the person that is having the crisis, they will send out one of our mobile crisis response teams. And those teams are run by Sound and DESC. And if the mobile crisis team comes out and they deem that you would do well to go to the crisis care center, they will transport you to the crisis care center that is currently open in Kirkland by Connections. And anyone who goes to the crisis care center will get post-crisis follow-up from the folks at Connections, and depending on need, from our post-crisis follow-up teams. And I'll go through a little bit more of that as we go along. Next slide, please. So in 2025, we were really, really busy doing a lot of support work for the folks in King County because we're not able to get a new crisis care center up and running quickly. We have to find the sites, we have to do the renovations, they have to fit very specific criteria to be a crisis care center. So we were also taking the time to use the money collected through the levy to make different types of impact to support crisis services. So the crisis teams went out over 5,000 times in 2025. They were able to respond in less than 45 minutes. There were new vending machines put in place that had naloxone for folks to be able to respond to overdoses. We had new crisis counselors embedded in the South King County 911 call centers so that they could help resolve calls that came in around mental health or substance use crises. Our designated crisis responders were able to hire a lot more folks, and they have now been able to get to people who call for a designated crisis responder in a much shorter period of time as opposed to a year or two ago when they were looking at about average 11 hours wait for a designated crisis responder. And we were able to help the integrated care network get more capacity and appointments for routine care. So all in all, we've been taking a lot of the money from the levy and being able to help shore up the crisis continuum. Next slide, please. So there are going to be 5 crisis care centers altogether through the levy. There'll be one in the North Zone, which is the one that is already open, and that's in Kirkland, and it's run by Connections Health Solutions. The Broadway site that I was just talking about, where we're having the open house, is in Capitol Hill, and that will be for the Central Zone, which is going to be Seattle and Vashon. The East Zone has a request for proposals that is currently open, so we have not chosen a operator for that, nor a site. And in the South Zone, we chose Multicare as the operator, and they will hopefully be able to identify some sites by the end of this month so that we can get going on opening that. We also currently have a request for proposals open for the Youth Crisis Care Center, which can be anywhere in King County. So that one will hopefully be ready to go in about 2028 once an operator is chosen and they have a site figured out. Next slide. Okay. So we want to make sure that people are really clear about what happens when you leave a crisis care center, because we want people to have the opportunity to understand that recovery is possible and that they are able to get their needs met and leave with a plan that will help support their recovery. So people will be able to get transportation assistance while they're at the crisis care center, individualized support. There will be culturally and linguistically appropriate services, and there will be, no pun intended, connections to outpatient recovery and social services that are already in existence. So the post-crisis follow-up teams have been chosen, and they will be peopled by PDA, Sound, and, oh Lord, what was the other one? PDA, Sound, and DESC, I believe. But those teams are not up and running yet, but they will be in the near future, probably by the end of the year. Next slide. Okay. Oh, Consejo, I lied to you. My apologies. Um, the post-crisis follow-up teams, Consejo, PDA, and Sound, launching the end of this year. Target populations for them are very specifically people who are experiencing behavioral health inequities. And for those folks, we will be able to make sure that they get more intensive support for up to 90 days, so that if they need help getting to appointments or they need someone to go with them, that the teams for the post-crisis follow-up will be able to go with them to those appointments and get them there. Next slide. Okay, and so what we have available now are things for people who are having a crisis right now. That means you can call or text 988 anytime. You can get a mobile crisis team to come out and help. And you can also go to the Crisis Care Center anytime you want. It's open 24/7. It's free to access services. You don't need to have insurance. You don't need to show any immigration papers. You can go anytime. There's a behavioral health urgent care, and that urgent care will pretty much take care of about 60% of people who show up at the crisis care center so that they don't have to stay for an extended period of time. Um, if someone goes to the crisis care center and they need more intensive support, they are able to stay at the 23-hour observation unit and get more follow-up there. So that's a great spot for somebody who needs maybe a little time to detox, maybe needs a meal and a shower. So there's that option for that. And there is also a stabilization program, which has 16 beds that people can stay in for up to 14 days. So all of the crisis care centers will have those components throughout the county. And as soon as the others are up and running, I'm happy to come back and give you updates about them. The Seattle site will likely open the end of 2027. The renovations are going to get started, I think, in August. We're still meeting with the design team around that. That site will also be run by Connections Health Solutions. And the other thing that I also want to make sure that you all know is that throughout the entirety of the levy, there are peer specialists embedded throughout all of our programs. And so there will always be somebody who has lived experience of either a mental health issue or substance use issue to be at the crisis care center and all of the other components of the levy to help you make the decisions about what's best for you in order to get what you want from your recovery. And last, I want to make sure that everyone knows that our services are voluntary. And as I said, they are free to anyone in King County. And I'm hoping that I can answer a couple of quick questions if anyone has any.
Thank you so much, Idabel. I'm going to leave this slide up for just a couple moments. If folks want to grab some of these QR codes, we'll also send this out after today. And I might lean on my colleagues a little bit to see if we have any questions, because I can't see much while I'm sharing the screen.
We have a couple questions in the chat, and we have a hand up right now from Karina. Do you want to go ahead and hop off mute?
Yes, thank you. Hi, Idabel. It's delightful to hear from you and to learn about these services. I'm curious, if I call 988, do they have discretion about whether they send somebody out or not? Or will they, because I've run into some issues with, I feel like it's a mental health crisis that really requires a in-person response, but the person I'm talking to on the phone, it doesn't rise to their level.
And I think that one of the things that we are still working on is making sure that folks who are answering the phones at 988 understand. We're making sure that they have mental health folks answering the phones who understand what a mental health crisis or a substance use crisis looks like, and that they will be able to help triage the help that the person needs when they call. If you find that you say to them that you think that the mobile crisis team would be the right choice, and they decide that it isn't, I'm going to put my email in the chat, and I would love to hear from you more about what happens with that call so that we can make sure that people at 988 are getting the training that they need to assist people in a crisis.
Thank you, Idabel. So we have a few questions in the chat, a number of which were answered, but we are running on short time. So I will ask this question out to you, Idabel. Well, let me just look in the chat here. Someone had asked for the email address to reach out to you. Idabel, you put your email at the bottom of the chat. We have a question here about, do you have to be living in the area? And I think that's referencing in order to access the services.
Anyone in King County, we will not ask for proof of residence. And so if somebody elsewhere hears about the services and comes to use them, they too will get services.
Thank you, Idabel. We also have a question. We have a few people asking about flyers. We'll be sharing those flyers along with our recap after the meeting. So please stay tuned for that. And also, if you have any questions, Idabel's email is in the chat right now. Idabel, thank you so much for sharing with us today. And apologies for the slight technical difficulties at the beginning, but really, really great to hear from you. And yes, please, folks, if you have questions that come up even later during the meeting, write them down. Go ahead and send Idabel an email or reach out to us and we can connect to you as well.
Thank you. Anytime you want me to come back and give updates, I am happy to do so.
Thank you so much, Idabel. I was kicked off of Zoom and I'm back now. So I think I'm next up to just have a complimentary piece. And maybe somebody can figure out what's going on with pinning presenters. Thank you so much, Idabel. It's great to hear, the moving process of implementation of what voters approved in the Crisis Care Center levy, and to see that although there is only currently one building open, that doesn't mean that we don't have additional services. And so now we are really delighted to welcome a couple of our colleagues. I believe it's Alex and Alex, I can't see everyone yet, so you'll introduce your colleague, please, from what I love, this name, the Mobile Crisis Response Team that DESC has called Meerkat. And we're really always grateful to hear from providers themselves about the nature of the work. Please feel welcome, Alex, to introduce yourself and your colleague if someone has joined you, and tell us a little bit about the Meerkat team and what you're doing so that people can understand a little bit more in detail. Thank you.
Thank you for having me. Hopefully everyone can hear me okay. I know sometimes between Zoom, Teams, and all the other systems we use, it can be a little tricky sometimes, but I saw some thumbs up, so it sounds like we're on the right track. I'm one of the clinical supervisors here for the Meerkat team, the Mobile Rapid Response Crisis Team. And wow, our service is vast. Idabel did a wonderful job overviewing some of Meerkat. And just to piggyback off of that, we provide services to adults experiencing mental health and SUD crisis throughout the city of Seattle. We serve zip codes all the way up to Shoreline, Richmond Beach area, and then even a little bit more south as well towards Skyway neighborhood, in addition to Vashon Island, which I think is pretty neat to be able to serve folks on the island. Our primary goal is to de-escalate and stabilize when people are in crisis and support them in the least restrictive setting possible. The design of Meerkat is really intended to be short term. So we help individuals from crisis to establish solutions, stabilize them, and get them connected to requisite services. And that can look many different ways depending really on what type of support people need. Oftentimes we are getting people connected to crisis centers, whether or not that's Kirkland Connections, which we're very excited for them to be opening their Seattle location as well. I think I heard by the end of 2027 roughly. In addition to, when needed, hospitals, though our intention is to divert away from hospitals and other emergency services when possible. And also too, the Crisis Solution Center, which is our main hub where we dispatch out of ourselves. And we are located in central Seattle, so very close to the International District, right off of Rainier. A little bit more about us too. I mean, we are able to get people connected to other requisite services beyond what I'd mentioned. A lot of the referrals that we do are to other agencies or even interagency when we're thinking about like homeless outreach, stabilization, and transition, which most people know as the HOST program, the Opioid Treatment Network, OTN, or now as most people know on 3rd Avenue as ORCA. Star Center, which is a PSH transitional housing center that is also right down on 3rd and kind of acts as an emergency shelter in some situations as well. And we also look too at like day centers, drop-in centers. A lot of us know like the Jefferson Day Center is a very popular one that we utilize. And certain occasions too, inpatient behavioral health, again, kind of depending on what the client is needing or what they're interested in. Especially as mentioned, you know, we are a voluntary service, so we only really get clients to where they are interested and needing to be. In addition to that, detox, withdrawal management services, and other crisis clinics as necessary. Some other updates on us recently is we are collaborating a lot with our DESC housing providers, and we are stationing many outreach teams at those sites. We call them satellite sites, which includes, again, Star Center. We also station teams at West Wing. We have an Inner Bay location. And the idea is if we have teams who are more spread out throughout the county, when we are doing dispatch with 988, we can assign the closest team to the crisis. So oftentimes we're meeting that 30-minute ETA estimate or less, ideally. So really glad that we can support people as quick and efficiently as possible. That covers our general updates on MRCT in addition to what Idabel covered, but I'm happy to answer any additional questions as well. I wouldn't be surprised if there's some mentioning that the World Cup is here. We've been doing lots of good planning for that and ensuring that we can best support the community, but happy to answer any questions.
Well, while we give people a second to ask those questions, I will ask, you know, the standard and most important one. I know that you can serve anyone in crisis. I just pulled a few key points off of your wonderful website. How do people get to the Meerkat team?
Great question. I think as we were touching on earlier, 988 is the way in. So anybody in the community is welcome to call 988. Providers, they might have more of a direct access line if Crisis Connections has shared that out with them, which is the same thing essentially as 988, but it has you skip the queue if you are, again, like a provider, which would be, you know, 911, fire, AMR, usually has more of a direct access to 988. And from there, 988, they determine what crisis team is the most appropriate to take the call, depending on the age of the individual, whether or not it is requiring family services, or if somebody maybe is more simply calling in for resources, they might, you know, flesh out if 211 is an appropriate domain for them to kind of look into, and they get a crisis team from there.
Thank you. I wonder if you want to just share any reflections that you might have as a service provider on what your experience has been like being able to provide this kind of service in the community, to the community.
That's a great question. Yeah, you know what? I've worked in crisis care for a good amount of time, but only about a year and a half now here with MRCT. And my thought is, I wish I knew about this service sooner. In all reality, MCT was prior to MRCT, which was very similar service. And it's been around a decade, but yet I hadn't heard of it. And so I'm loving that now there's a lot more visibility. You might see some of the city buses that are wrapped in 988 logos. We're talking to more community partners than ever who are aware of exactly who we are, how there's a warm line, there's a crisis team that can help as well. So I think it's been an incredible experience, especially as the community is learning more about us and we're getting more exposure and we're able to help people at broader levels than ever before.
Wonderful. Thank you so much, Alex. We put the request to have someone from the Meerkat team join us out really, really spontaneously and quickly. I'm so grateful that you were able to join us. And I think we're going to try to do this with some other variations on the theme, so people get a chance to hear directly from the crisis responders and get a little bit more familiar with the different resources and human beings who provide those resources, who are part of our community response system. So we'll welcome you to stay if you'd like to. We'll welcome people to put any additional questions in the chat or suggestions of what folks you'd like to hear from next time. And we thank you so much for joining us.
Likewise, and thank you for having me. I'll drop my email in the chat. That way, if anybody does want to follow up or whatever, like to touch base, I'm always happy to jump onto a call. Truly, it's wonderful being able to connect with our providers, learning the other perspectives of not only providers, but folks in the community as well, and how we can continue building on these services. So thank you so much for having us.
Fantastic. Thank you very much.
Thank you.
Thank you, Alex. And yes, I see a lot of thumbs up in the chat around the info that Allison shared for the Meerkat team. Please, Alex is going to share their email in the chat and send any questions there. Moving forward, I want to welcome Natalie Gonzalez to hop off mute. Natalie Gonzalez is from DSHS to share about Sunbucks. Natalie, I have your slides up and going, although you're more than welcome to run your own slides if you prefer.
Okay, yeah, I will go ahead and steal the screen grab if that is okay with you.
Yeah. I made you a co-host, so just go ahead and share your screen.
Wonderful, wonderful. Okay, let me get that going. Thank you so much.
Like I had mentioned earlier, Natalie is the Sunbucks program manager. And so we're looking forward to hearing about how to access Sunbucks, who all is automatically eligible, and other ways to make sure the families you work with can get and access this great benefit. Thank you, Natalie.
Are you able to see that slide, that first one there? Okay, cool. So good morning, everybody. Thank you so much for reaching out, Kevin, for this. I really appreciate you inviting me to this meeting this morning to share this news about the benefit coming back. So once again, like Kevin mentioned, my name is Natalie Gonzalez, and I am the Sunbucks program manager at DSHS, managing this wonderful program. I know that you all worked with Troy Burgess in the past. He has been called to other duties because he has so many skills that they are moving him around in the agency. So super excited for him. But now you'll see me, and if you have any questions, you can ask them to me. So we are working in collaboration with the USDA to administer the program. So just to level set, so what is Sunbucks? So Sunbucks is a one-time $120 grocery benefit to low-income families with children who would have otherwise received free or reduced price meals at school if not for summer break. A little bit of the history of Sunbucks, just because I find it pretty interesting. So Sunbucks has two names. So summer EBT is what you'll likely hear at the federal and legislative level when we're asking for funding and things like that for the program. And then Sunbucks is a name that has been adopted for the program and is a name you'll likely hear in the community and from families. So the summer EBT pilot programs began in about 2011 in roughly 4 or 5 states. Data from the pilots showed that the summer EBT model helped decrease food insecurity by roughly 30% over the summer months. And then as a result of those piloted models, pandemic EBT or PEBT was developed and implemented in response to the COVID-19 nationwide pandemic. And then in 2023, the national state of emergency ended, and the Consolidated Appropriations Act of 2023 established summer EBT as a new permanent program on a nationwide basis. So this is why there are some similarities, or some people might, miss up the two of pandemic EBT and summer EBT, but there are a few differences between the two programs. And then as a result of that Consolidated Appropriations Act of 2023, FNA provided branding in 2024, which renamed the program Sunbucks. So that's how we got here. Excuse me. So Sunbucks is in its third year. So 2024 was the first year, then 2025, and now we're in 2026. But I just wanted to share some highlights of last year. So for 2025 Sunbucks, we issued roughly $66.7 million in benefits to about 554,000 children. So just to kind of put that in perspective, sorry, struggling with the word there. If you look at the OSPI, so the school's website, it indicates that roughly 1.1 million children were registered in school in 2025. So if you look at that number, 504,000 compared to the 1.1 million, we served about half of the kids in Washington State with Sunbucks. And so 99% of those children were automatically enrolled. So this card just showed up at their house, loaded with $120 of grocery benefit, ready to go. And then 87% of those issuances were set in July through the automatic enrollment process. And we'll talk about that here. Okay. So DSHS has two ways to be automatically enrolled in the Sunbucks program. So the first one is through the schools. So a child would have to be enrolled in a school that participates in the National School Lunch Program or School Breakfast Program and individually approved for free reduced price meals. So I say individually because there are some schools out there where every kid gets free reduced price meals because of the community eligibility provision or CEP status that the school has. But if somebody wanted to qualify for Sunbucks automatically, they would want to make sure that their child, they fill out the forms that they get in the beginning of the year that make them automatically eligible for free reduced price meals. Now, I know that there's other pathways to be eligible for free reduced price meals, like being on SNAP. There are homeless children that are automatically enrolled in free reduced price meals that route. So there are a few other routes that children could be automatically enrolled in the Sunbucks program. And then the second option for automatic enrollment is a child would have to be a member of a household receiving SNAP or TANF, and then the Washington compulsory age of 8 to 18 years old. And so DSHS has been approved to work with SNAP and TANF. At one point, we were able to work with state funded assistance, which is our state TANF program, and then our food assistance program, which is our state food program. So we were at one point able to work with those programs as well for automatic enrollment, but federal guidelines have changed and we're not able to do that. And so families who are not on SNAP or TANF and are on SFA and FAP, they are income eligible for benefits at DSHS, but they don't meet the immigration standards to get federal food benefits or federal cash. So the immigration piece does have a part to play for the automatic enrollment process. But if you apply for Sunbucks, we don't look at immigration. We don't ask about citizenship. We don't ask any of that. So some folks out there, if they're on some state-funded DSHS programs, they might want to apply and they would like to be eligible. So just a plug there. And then the third option to enroll in the program is to apply. So like I said, 99% of folks get the cards automatically to their front door, but there are some families who may have to apply. And our Sunbucks application online portal is open year-round. And then our paper application is available on our website. And it comes in roughly, I think, 16 different languages. And like I said, once again, we don't look at immigration or citizenship or anything like that. And then here is the information on the Sunbucks website. So the link is there. And there are a few options. So you have like a simulator, like should I even apply? And you can enter your information to see if it's worth it. And then you can also apply there. And like I said, the application is open year round. However, our summer operational period operates only during the summer. So the summer operational period, we're in it right now. But when that ends on September 4th of 2026, if somebody submits an application after that, then we'll hold it till the next summer operational period starts. So just something to be aware for folks as well. Okay, so redeeming Sunbucks. So this is what the card looks like. It is colorful. It's for the summer. We wanted to make it, you know, like some summer colors there. The cards are issued to each individually eligible child. So that's a little bit different from SNAP benefits. So folks who get SNAP, usually it's to a head of household or an adult, and then it has all the family's benefits on it. But for Sunbucks, if a family has 3 children, they'll get 3 Sunbucks cards, $120 each. And we did hear from advocates last summer who strongly encouraged new cards going out to everybody because folks were losing them in between, you know, summers, just not realizing that the program was going to start up in the next summer and things like that. So we are sending out all new cards in summer of 2026 to people. And that has created a little bit of a snafu for us because for Sunbucks this year, our federal funding was held up a little bit by FNA. And so when we did receive funding, we sent roughly 304,000 children over to our EBT card vendor called FIS. And because multiple states had their funding, you know, delayed, now they're backed up. So we are getting social media messaging out there to folks and text messages out to folks who have options to text messaging, letting them know like, hey, we are sending everybody new cards, but right now they're delayed. So some folks are seeing that a benefit is available to them in their online account, but they can't access it because they don't have the card. But we are working really hard. We're meeting daily with our FIS vendor to try and make sure these cards are getting out. Our vendor is working on the weekends. So we are making the effort. It just is going to take some time this year. So Sunbucks benefits can be used like SNAP to purchase food at grocery stores, farmers markets, and other retailers that accept EBT cards. And the Sunbucks card is eligible for the market match and the produce match at the store as well. And then one thing to note about the benefits is that they do expire 4 months or 122 days after issuance, which is different from SNAP. So if folks have a SNAP card and a Sunbucks card, they're going to probably want to use the Sunbucks card first because those benefits are going to expire first. Proactive communications. So if somebody would want to opt into text messaging to receive information about their benefits straight to their phone, they can follow the QR or text or go to that website. It's linked on our main website, but that is a direct website there. We do have a Sunbucks one-page handout in English and Spanish that kind of gives a rundown of everything that you need to know about how to become eligible for Sunbucks. So this might be helpful for you know, any touch points you might have with the community to be able to just give quick information. It's not anything on an individual level, but it kind of just gives an overview of the program. And then so how folks can help. So I do have some links to an outreach kit in this slide if anybody's interested in printing anything out and having anything available at any sites or any, like I said, touch points with the community members. When school is out, because now it's out for most folks, encourage people to apply for Sunbucks. The application is, like I said, open year round. We are monitoring those and tracking those as they come in. And then you can also direct families with questions directly to the Sunbucks Contact Center. It is staffed year round. The staffing does fluctuate with the season. So right now, because we are in the main peak season for Sunbucks, we've got about 40 agents at that Sunbucks Contact Center. And then after summer, we go down to 4, which is interesting. But yes, it's open Monday through Friday. except observed holidays, and folks can reach out to that contact center and ask direct questions about their Sunbucks. And here is the link to the outreach toolkits in our Sunbucks website. So the USDA has a good outreach toolkit that they developed for Sunbucks, and then Hunger Free Washington, which is through the United Way of King County, has developed a really good toolkit as well. And I know that they have grants and funding to help print materials and ship materials. So if anybody's interested, they are happy to help. And things are available in multiple languages, things like that. So that's available to folks.
Natalie, thank you so much. I know you have a number of those links there. And so if for folks who can't click on that, we're going to go ahead and put that in the chat in just a few minutes.
Yeah.
Have your question slide. We do have a couple questions in the chat, but a couple questions for me, just clarification wise, and maybe that'll answer some of the questions. You did, thank you for letting us know about the delay in the cards. There's a question in the chat about that. Curious, I guess the question in the chat is, do you know when people can expect to get their cards? And first off, it's just great for us to know that in case we're fielding questions from our community about, hey, why don't I have my card yet? It's good to know that there's a delay, but do you know when people expect to get their card in the mail?
I don't, unfortunately. They're so backed up. So we sent them 304,000 children, and they've only sent 3,000 cards out. And so there is a list of that 3,000 that we have sent over to the folks in the contact center. So if they call and they're on that list, a contact center agent will be able to tell them that. But that's all I got right now.
And that's a small number. So I think it's good for service providers to know, hey, it's likely still in the mail or it hasn't gone out there to you yet, because we know the majority of them. But that's also great to know that it is coming in the mail. A quick question for clarification. You mentioned a couple things about folks who are eligible for FAP and whether they're eligible for this. And just wanting to clarify and just state it very clearly. If you're accessing FAP in Washington State, you are eligible for Sunbucks. Is that correct?
I would say most likely. I would never want to say a definite. There could be other factors, like if their child is too young, right? There's
right.
Or not registered. You know what I mean? So I don't want to say everybody, but more than likely, yes. School aid on that.
Yeah, and for folks who might have been a little bit confused, there's just a lot that goes into how these services are funded, and oftentimes it's a combination of federal and state funds. And with a lot of the struggle that's happening, the state is really footing the bill for a lot of it. And it's great to know that this program is still going. I see a hand raised from Allison.
I just want to repeat what I think you said, Natalie, that you've sent over 300,000 kids' names to the people administering this program, and 3,000 cards have been sent out?
Yes. So
that is outrageous.
I know.
So we have seen this happen with Sunbucks before. We understand that the federal government is making things much, much more difficult, but school is out. It's the second half of June. Is there any way for families to be able to access benefits? And I think this was also a question in the chat, even if they haven't received the physical card.
Yeah. So, and it's when we sent the 304,000 kids over, we sent them to the card processor. So it's the card processor that's so backed up because other states have also been delayed. That is where we're running into the biggest delay there, unfortunately. And like I said, we're working with them daily almost. They're working on the weekends. They've got all their hubs open in the United States. You know, everybody's doing everything that we can. You know what I mean?
Certainly, Natalie, I think there was a question at the very end about if people can still access those funds without the card. Can they go into the office and just some clarification? Okay. Well, Natalie, thank you so much for sharing this, important information. I think everyone in this audience is somewhat accustomed to not, maybe not hearing the greatest news, but at the same time, we need that information to roll with it and understand how to support the families and, in this case, the children that are seeking our services and that we're supporting through some very serious crises. So thank you, Natalie, so much for being here and sharing this information. Hallie did grab some of those links, and it is in the chat right now for folks who want to learn more. And also, please reach out if you have other questions. Natalie just put her email into the chat right now. And of course, on our end, if we get any updates related to Sunbucks, we'll be happy to share them at our next membership meeting as well. So thank you again, Natalie. Moving forward with our agenda, we have Hallie Willis, who you've heard from today. Hallie, please join us once again and hop off mute and take us into our advocacy action portion of our membership meeting.
All right, thanks, Kevin. And Natalie, thank you so much. We really appreciate all the folks at DSHS that are working hard to get kids the food benefits that they need. We know it's really complicated and there's all sorts of federal shenanigans going on, which is an excellent segue to our advocacy portion of today's agenda. We have a few things to talk about today, but first I wanted to give an update on sort of the housing universe of funding. So shifting a little bit from thinking about food access, which you will continue to hear from us about, including as we go into the state legislative session, just to like sprinkle that a little preview in there for folks. I wanted to share that we received the 2026 NOFO, the Notice of Funding Opportunity for the Continuum of Care grant through the federal government. This is a really important grant that it's available to communities across the country. Here in King County, we receive about $67 million every year, and we use about 80% of that for housing for people who are formerly homeless. It is a extremely important funding source for that kind of work, and is currently keeping thousands of people housed across King County. If you have been here with us for the past year, you have known how amazingly turbulent this fund source has been. The federal administration is trying to mess with it in any way that they can. Last year's grant is currently the subject of multiple lawsuits, and this sort of shifts us into a new wave of advocacy with the new restrictions that they're trying to add on this fund source. So I'm not going to go like super deep in the weeds, but I will describe just a little bit of what's going on with this fund source because it does, it's going to tie into our advocacy. So what we are seeing is the federal government trying to restrict how much money we can use to support people in housing. So they're trying to shift us from that 80% that we use right now to a maximum of 60%. So that would be a huge cut to permanent housing. And they're also using all sorts of different preferences and restrictions and criteria to shift us away from approaches that we know work to end homelessness, like housing first and harm reduction, and to shift federal funding away from those, away from permanent housing as well, towards more sort of like temporary interventions. So this is a really big deal. This is a huge change to this fund source and a huge change to our system if it proceeds. So what's happening now is three things. The KCRHA, which is our continuum of care in King County, is putting together the best application they can in order to draw down as much funding from the federal government. That's item one that's happening right now. Item two is that people everywhere, organizations everywhere are evaluating this NOFO to see if it is lawful, and if there should be lawsuits filed against it. To the best of my knowledge, that hasn't happened yet, but people are evaluating that possibility. And then the third thing is what we need to do. So we, leading up to our budget process in Seattle and King County and Washington State, will need to advocate for funding to keep folks housed and keep those services running that are currently funded by those federal dollars, should they go away. And I should say that there's sort of lots of scenarios possible, the worst of which is that the federal government yanks our entire grant. They just did this to LA. So that would be an enormous loss of $67 million. That's sort of our worst case scenario that we will need to prepare for. So we were one of the only communities in the country last year that was able to secure local contingency funding in the Seattle and the King County budget to be able to keep people housed. That was because of the work of you all, this coalition, our partners, our community, and we will need to rinse and repeat. We're going to do that again, y'all. So buckle up. There'll be lots of advocacy for us to do coming up. So just wanted to preview that for you a little bit. We don't have an action to take on that right now, but wanted to cue people up. And then Allison, did you want to jump in before we chat about other actions?
I'm ready to chat about other actions.
Oh, gotcha.
Time comes. Yeah, sorry.
Okay. No problem.
Preparing.
I just saw you come off mute. Okay. So one action that we can take today involves other federal shenanigans about the equal access rule. So this is something that we've mentioned at a couple meetings previously. We're doing it again because the deadline is coming up in about 11 days. The public comment period will close. So the Trump administration is trying to restrict access for trans, intersex, and non-binary people to access HUD-funded housing and services that best meet their needs. They're doing this through a rule change to what's called the Equal Access Rule that would require people to match biological sex with the services being offered. For example, if it's a women's shelter, you would need to match the biological sex assigned at birth of woman. That is opening a huge door to discrimination, and it would bar lots of people from accessing services that they need. And it would also do crazy stuff like allow service providers to demand proof of someone's biological sex in order to access services. So huge infringements on privacy, huge risk of discrimination, and we really want to shut this down. The Trump administration tried to do this in Trump 1.0 and failed because of all of the negative public testimony that people submitted. So we're going to drop a link where folks can submit their comment. If Zoom will let me, I can also drop some draft testimony that we've put together. If people want to use that as a template, you're welcome to. You're also welcome to do your own thing. But this can at least give you a starting place. So would invite folks to speak up for that. The deadline is June 29th. And please do share it with your friends, share it with your community. Let's shut this down again. And with that, I'm going to pass it to Allison for our next action.
Thank you very much, Hallie. I want to, just take a moment here. I know we've been, we always pack our agendas, you guys. And we do it because an hour and a half is not enough time to cover all the things once a month. There is so much going on. So let's just take a breath. If you're in a place where you can turn your camera on, please do, because we're talking about really hard things. And it is really hard to do that and to keep our spirits up and to feel our collective power. Thank you, Karina. Thank you, Angie. Thanks to everyone who's already on camera, because what we are talking about here is collective power. Taylor Farley, thank you, Queer Power Alliance. This is how we prevent discrimination. in housing and shelter. Your comments on the equal access rule, on this proposed change to the equal access rule, are one small and powerful way that you put your voice in front of the attempt to bulldoze the protections that have been fought for over many years by people who are still fighting. And those of us who have come after them need to pick that fight up and protect the wins for equity, for equality, for anti-discrimination. So if you've already taken action, thank you. The June 29th deadline means get as many other people to take action with you as you can. Oops, did I say that wrong, Hallie? No, okay. So June 29th is the deadline for that particular action. Now, thank you so much, everybody, for coming on camera. It really is so much easier to just like feel that we are in this together and we are going to take action together. Take a deep breath because I've got something else really wretched to tell you about that we are also going to push back on together. Raise your hand, virtual or actual, if you have voted by mail in any election. That's right, here in Washington State, we are almost completely a vote by mail state. And the United States Postal Service is an incredibly powerful tool in expanding access to democracy over barriers of transit, mobility, ability, disability, working schedules, pick up the kids' schedules, etc. In addition, our state legislature has passed laws and provided funding to ensure that now when you get your vote by mail ballot, you can mail it without a stamp. All the things that we have fought for to increase democracy, to increase who gets to vote, to make it easier for people, including folks experiencing homelessness, including people who do not have a traditional residential address to vote, are also under attack. Just a few days ago, the Trump regime got the United States Postal Service to issue a proposed rule that would attempt to restrict the Postal Service from delivering ballots in any state that refuses to turn its voter registration rolls over to the federal government. You heard me. This is another outrageous attack on our democracy. Now, we have the opportunity to make a public comment on that as well. And the deadline is coming up. It's a different process, which is why we're not dropping a link in the chat right now. We are just putting you on high alert. It is despicable, Martha, we agree. But there's something we can do about it. And I'm really happy to tell you that here in Washington State, our Secretary of State has already issued a response. I'm going to share that with you in the chat. We just had a meeting yesterday with the folks from King County Elections. They are not playing. There will be lawsuits if there aren't already lawsuits. And here in the chat is the link to the Washington Secretary of State's statement in response to that proposed rule change. We also need to flood the United States Postal Service's, I'm going to get the title wrong, but general manager, the person in charge of the U.S. Postal Service, with comments opposing this proposed rule change. And that is just the way things are going right now. We have to be on it because every day there are multiple attempts to do despicable, outrageous, anti-democratic things that target queer folks, Black and brown folks, immigrants and refugees, women, and basically all of us. And we have to be smart. We have to be in alliance with other groups that can alert us. And we pledge to alert you to the ways that you can not only take action yourselves personally, but you can help other people take action as well. so excited to see Emily Meyer here from Everyone Deserves Housing. We got to go to the opening of their shelter a couple of weeks ago at the Bayside, and we're really excited to come and help folks moving in there register to vote and get their mail-in ballots and participate in the electoral process, which is the right of every eligible voter in this country. And we're going to continue to partner with you to make sure that those rights are well understood, broadly applied, and upheld. Yeah, that emoji, there is no emoji. We're beyond the emoji world, but I feel you, Taylor. I have lost the ability to see our agenda, so I'm pretty sure that my time is up. I want to, if I may, take like one more minute to preview for people another thing that's going to be happening. It is going to happen, and we are going to respond, but you don't have to be responding solo. The point in time count data for our community are going to be released next Tuesday, June 23rd. I'm not going to say raise your hand if you think the number went up, because I think we all know what the reality is on our streets, in our communities, in our full shelters, and our full housing programs. Although there is excellent work happening in this community and many others to house and shelter many people all year long, our point in time count results are going to show that more people are becoming homeless than our system is able to assist in the course of a year. So we are going to do our best at the coalition in partnership with all of you to answer questions, to respond, and to help people keep focused on the reality of what we know works. And as Hallie beautifully explained it earlier, of what we need to do to protect the homes, the thousands of homes for thousands of people that are funded through city, county, state, and federal dollars in this community, no matter what the federal administration decides to do. Shenanigans used to be one of my favorite words, but now Hallie uses it all the time to describe things that I would use a very different word starting with SH to describe. but I am attempting to match my staff's professionalism by not using that word in this meeting. So we'll just stick with shenanigans for now. And just know we are in this together. So thank you so much. It's really wonderful to be able to, understand that this coalition touches thousands of people every time we send a message out, thanks to you and your work and your community connections. And we can really amplify our messages. And there's going to be a lot more of that coming our way. Okay, I'm turning it back to Kevin, Hallie, for whatever we have that is next, because I can't see the agenda. Thank you.
Thank you, Allison. Yeah, Hallie, if you have any more any more advocacy action, please go ahead. Oh, looks like we're wrapped up with that, and we're actually right on time with our agenda. Thank you so much, yes, to both Hallie and Allison. It's a lot of information, but we're all doing our best to soak it in. And also, we had mentioned just earlier, just backing up into the chat, Hallie, or it looks like maybe Danielle had shared the sample comment, and we had a request to get that in email. So we will get that out to folks to make sure they can take action. Right now, we're just going to move over to just give a few more staff updates and really coalition updates. First thing is first, I'm going to drop the link for folks to sign up for our emails. Please sign up for our emails. You probably are already signed up, but we know not everybody is, because these links get shared out for our meetings pretty frequently. So if you do want to stay connected or be more directly connected to the coalition, really encourage you to go ahead and sign up. Here is the link in our chat right now. Thank you to all of us who joined us at our last two in-person meetings. This happened over the last month. First was our annual membership meeting at El Centro de la Raza. Great time. So great to see so many faces in this room in person. Thank you all for coming. And then just after that, last Friday, we had the return of our lawn bowling. We had, I know there's an exact number, but certainly over 50 people in attendance. Really fun. The weather, of course, was helping. It was great food, great opportunity just to chat and catch up. So we're always so busy, and so thank you all to those who came. And if that sounds like fun, please stay tuned. We are really hoping to have more in-person events. In fact, our next training that is coming up, for our next couple trainings that are coming up, our next one is going to be our Helping Homeless Students McKinney-Vento 101 training. This is always in August. We don't have a date set yet, but we are really looking at August 20th. That is the normal sequence for our membership meetings that probably won't be, that normally don't happen in August, but we're also looking at the 18th, so please stay tuned. We'll have a sign up for that. And we're also, again, just really trying to see how many more in-person meetings we can do as time goes forward. Our next membership meeting is July 16th. That one is for sure online. I'm going to go ahead and put the registration link into the chat right now. We have, of course, we're putting together a wonderful agenda for you all. I see a couple notes in the chat, just kind of reiterating some of the things that I've been saying as far as these announcements. Moving forward, World Cup is happening right now. So if you are seeing impacts on people experiencing homelessness, impacts to your operations and programs, especially if you're in the CID, Pioneer Square, or stadiums area, please do reach out. You know, Hallie and I have been we hosted a meeting just this Wednesday. It was kind of open office hours for service providers in the area to share their observations. Good news is nothing major, but it was really great to hear from different organizations about the things that they're observing. And, you know, it may take a couple weeks or a few more games for some of these pieces to develop into a fuller picture, but we are absolutely holding space for that, and we want you all to please reach out. I have here in the chat a link to our blog on the World Cup. It's got all the information you would need, and of course that information is being updated on that blog. Upcoming games, not that you have to write this down, but just to keep it on your radar. Tomorrow is going to be a very busy day in Seattle. If you don't have to be out and about, I would encourage you to stay off the roads unless that is your plan to enjoy some of the excitement. 2 games next week, the 24th and the 26th, and then into July 1st and 6th. So just keep in mind all the parking restrictions, the road closures, and the rippling effect that will have throughout the community. Also want to share for you a PDF resource guide from our friends over at the Coalition Ending Gender-Based Violence. It is a PDF. I want to say it's like a one-pager. It's probably a few pages, but you can print that out. It's got really great information regarding gender-based violence and that intersection with a gigantic global event. And we also know there's been some trainings about, being aware and developing awareness and stronger awareness for human trafficking. And that brings us to our member announcements segment. I know I just mentioned the Coalition Ending Gender-Based Violence, but we have a number of guests who we're excited to just hop off mute and share a little bit. So if I could have our guests from the Coalition Ending Gender-Based Violence to share about the launch party for the Trans Resource Guide.
And I don't know if they were actually able to make it. If I'm wrong about that, please jump in. But
okay, we can share it in the chat.
Yeah, I can just go ahead. The Coalition Ending Gender-Based Violence is having a party this Saturday, which sounds so fun. I'm really sad that I can't go. I have literally 2 birthday parties to go to, but they're celebrating the release of their Trans Resource Referral Guide. And that party is going to be this Saturday, June 20th, starting at 7 p.m. at the KEXP Gathering Space down at Seattle Center. Should be super fun. They're asking for folks to RSVP, so please do that. We're also trying to have them back at a future membership meeting to share some of the information that they've put together in that resource guide. So check that out if you're interested. It looks like a blast. And we've also got Another update queued up from our friends at Everyone Deserves Housing, who just opened a brand new shelter in Inner Bay. So I'll hand it over to Emily. Thank you.
Thanks, Hallie. Yes, so thanks everybody. It's nice to be here at the coalition meeting. Wanted to give you an update. We did open the Bayside shelter. We had our opening event with the mayor last weekend or weekend before last, and then we did a provider open house on Monday of last week. It was great to see several of you come through and see our new space. We started moving folks in last weekend. And so far, we've moved in 15 folks. You may have heard on, which is really super exciting. You might have seen some things on the news that are questioning how slow we're moving. I think we're trying to do a nice job in 5 days of balancing moving folks in, knowing the crisis of people being outside, while also taking an appropriate amount of time to get to know people and move them in thoughtfully, work on housing plans and all of that. We're anticipating moving in another 15 folks next week, and trying to be full sometime by the end of the second week of July. So that's a little bit about what we're doing right now. The city of Seattle is coordinating with outreach providers in district. I believe we're 7. It might be 6. Sorry. Um, and that's how things are going right now, but it's very exciting over at the Bayside Shelter.
Thank you so much, Emily. Hallie, go ahead. Did you have any other comments?
Oh yeah, I was just going to ask, like, do you have any advice for folks who are maybe seeking shelter or want to get connected to Bayside Shelter? Is there anything that folks should know if they know people who are in that situation?
Yes, we are getting a lot of emails from folks who are really interested in either moving in or referring clients in. So, as I mentioned right now, the city of Seattle is coordinating those referrals. Our referrals are all being taken from, there's a group of outreach providers that have been meeting and working for quite some time on the FIFA impact zone. And so our current folks are they have a by name list of people who have been sleeping outside in that FIFA impact area. And so those are the people who have moved into shelter so far this week and who we're anticipating moving in next week as well. And once we get past that that's likely to be probably the week after, I think, as well. Once we get past that FIFA impact period, then we'll be likely taking more neighborhood referrals. The city has identified outreach providers who are in our Inner Bay neighborhood. So they'll start coordinating with those outreach providers for how they will be referring folks from the neighborhood into our shelter. So more to come on that process. Right now, we are taking folks from the FIFA impact area who are on that by name list.
Emily, sorry for interrupting. My name is Jonathan. I'm from the Salvation Army. I'm actually one of those outreach providers, and I'm not on camera because I'm doing outreach in Inner Bay right now.
Perfect.
So, can I get your contact information from, say, Tamika over at the city, or I'd like
Yeah,
to touch base.
I can also just I'm Emily at Edie. How about if I put my email in the chat? Is that helpful?
I hope so. I'm on my phone. I've been having trouble accessing the chat, so I'll see what I can do.
Yeah, also I know Tamiko's on vacation this week, so that's why I
Yes.
hesitate to say otherwise that would be great. Um, but yes, I'm happy to connect with you, Jonathan. I'd look forward to that.
Okay. Thank you very much. I'm glad to run into you in this meeting.
Yeah, it's nice to run into you as well.
Thank you so much, Emily, and thank you, Jonathan. I'm going to go ahead and stop the recording now. I forgot to do that before community announcements, but I'm also glad that we got some of this info there.